Ruben, can you help us with the sound? Hello, Ruben. If you can hear me, kindly help us with the sound, okay? Okay, so what else? We wait for the sound to be connected.
Hello, everyone. Welcome to this year's session. Whether you are a teacher, a therapist, a caregiver, a medical professional, or a parent, your participation means learning, and that choice alone says something powerful about who you are and the work you do. Hope Our Foundation is built on a simple belief: every person deserves dignity, access, and the chance to thrive. We work in underserved communities where support is limited and awareness is low. Our focus is on choosing to help bridge the gap between those who receive quality care and those who do not. We run outreach programs, connect families to resources, and work with frontline professionals to build the kind of knowledge that leads to real change on the ground. At Hope Up, we do not just talk about impact. We go where it is needed most. We felt it was important to mark this year's Autism Awareness Month with more than a social media post. Autism affects millions of people worldwide, yet many who live and work with individuals on the spectrum still lack the tools and training to offer meaningful support. The gap is not a failure of effort. It is often a failure of access. And this webinar series exists to contribute to bridging that gap. For the period, we are bringing together some of the best minds in autism education, behavioral support, and inclusive practice to share what works. Over the next few days, you can expect sessions that are practical, honest, and grounded in real experience. We will cover communication strategies, sensory considerations, classroom and workplace inclusion, family support, and much more. Each session is designed to give you something you can use right away. There will also be dedicated time for questions, peer discussions, and shared reflections, including post-webinar support. This is not a passive experience. We want you to leave each session feeling better equipped than when you arrived. Alongside the webinar, we are offering continuous professional development opportunities for those who work directly with individuals on the spectrum. These are structured, accredited, and built around what practitioners actually need. We understand that your time is limited, so everything has been designed to be focused and meaningful, because learning should feel useful and not like just a tick of a box. We are grateful to every speaker, partner, and participant who has made these webinar sessions possible. Most of all, We are grateful to you, the people who show up, who ask questions, who go back to their classrooms, clinics, homes, and try something different. You are the reason this work matters. On behalf of the entire Hope Park team, welcome to a week of learning, connection, and shared purpose. Let us make the most of it. Thank you very much.
Thank you very much. And that was the opening by the CEO of Hope Park Foundation, Madam Adelaide Atta Konsa. And so without wasting much time, our speaker is in high spirits and we love to hear from her. She loves that smile. I like that smile. Exactly. Okay, so I'll read. So we basically, can we have the profile of our speaker before we introduce her? And so I want to say welcome to all of you for coming for today's session. And I want to say that you are going to be enriched because the speaker we are about to introduce is no other person than Madam Adelola George. She is the director of Jordan Learning Consult, a special needs education consultant firm. She's particularly passionate about learning and inclusion of children with special needs in schools and in the society. Since 2008, she has worked with children and teenagers with autism spectrum disorder, Down syndrome, cerebral palsy, and microcephalia, and other specific learning difficulties. Adelola is a trained behavior specialist. She holds a Bachelor of Science in Education Biology from Obafemi Awolowo University, Ile-Ife in Nigeria. Trained at Pleasant Places Training Academy, she is certified by the International Board of Credentialing and Continuing Education Standard, IBCCES, as an autism specialist. She is also an alumna of the Ziba Leadership Initiative. For her work, she's won the Acolyte Foundation Teacher of the Year Award in 2018 and was the finalist for the Nigeria Prize of Difference and Diversity Award by Joy Incorporations in 2020. She speaks at various conferences, seminars, and advocacy programs. She is the convener of the Special Needs Conference in Nigeria, which is organized to teach the society on how to engage people with special needs within the community. Participants, with a round of applause, I want you to use the emoji applause. Let's welcome our keynote speaker and our speaker, Madam Adelola George.
Hello, everyone. I am excited to be here today. I'm really happy. Thank you so much for the invitation, Open Foundation. I'm really grateful for this opportunity to speak to everyone here, and maybe people that get to watch it again in this time celebrating Autism Awareness. I love that this program is in May, not in April. I mean, I'm used to April events because April is Autism Month, but it's good to see that we are reminded again that autism doesn't end in April, so the awareness should not end in April, the conversation should not end in April. So today I've been told to talk about, so today's conversation, starting this event, we're looking at unmasking autism, or autism unmasked, and I'm looking at it from the perspective of what everyone should know. So what everyone should know, families, family members, teachers, educators, professionals, anyone in the business, as it were, any stakeholder. And guess what? The community, what should you know about autism? What should you know about these wonderful individuals that we're talking about? And what is the first thing to know? The first thing to know is even autism. You know, many years ago, I'll start with many years ago, but then I think that I don't have to look for stories from my past, but many years ago, I worked in a center, an autism center, and somebody brought a child to the center and said, "Oh, they said my son had autism." In fact, I think that like we did the assessment and like, this boy does not have autism now, you know. We did. So I don't do, we don't, first of all, it's not a diagnostic assessment. It was supposed to be a skill-based assessment to know, okay, what does he have? What can he do? What can he not do? What are his strengths? What are the weaknesses? So that we could then draw up a plan for him. Or just like a normal assessment, before any school takes a child in, they will do an assessment first. So that was the kind of assessment. And then we asked the parents, well, who said this boy has autism at all? And they said, it's his school. His teacher said he's autistic. And it was simply because the boy would not sit down, would never sit down in class. That was the criterion that the teacher based her diagnosis on. Teacher who does not have the right to diagnose the child, you know. Recently in Nigeria, there was one news about someone marrying out his autistic wards. So they're not his own children, also adopted children, like that. But these are adults, as it were, adolescents that he was marrying out and say autistic. And sometimes the question is it really autism? What exactly is autism? So it's possible to label a person without maybe a disability, even an invisible disability as autistic, just because of whatever reason I'm going to get into. Or it's also possible to label someone who has another disability as having been autistic. So what exactly is autism? So autism, the word autism is the more common, the main term is autism spectrum disorders. Autism spectrum disorder is an umbrella term for the neurodevelopmental disorder. It is characterized by deficit in social skills, verbal and non-verbal communication, including stereotypic and repetitive behaviors. Recently, I was telling someone that sometimes I think we should bring back the term odd behaviors so that so that it can help provide some imagery for us, the visual, when we talk about these stereotypic and repetitive behaviors. Because this can look like flapping, covering the ears. Some people do this. We'll get into a bit of that as we talk about the key things that I believe families should know, educators should know, and clinicians, everybody in society should know about autism. But these behaviors sometimes can be injurious, to be honest. Some of them bang their head, some of them bite themselves. Some might bite another person or hit another person. So we cannot shy away from the possibilities of that. Other stereotypic or behaviors that we might find will be the person arranging cars, toys in a particular order, or even just gathering toys in a particular order. You find them, they sometimes you can find some of them choosing to be isolated. In fact, most of them choosing to be isolated, whether even in a large gathering, everybody's there. They are not leaving the room, but they're sitting alone. They're just alone. Sometimes there's what we call parallel play, where everybody's playing. The child is among those that are playing, but he is not playing with the other children, right? So that's a possibility. So basically, well, like we said, there must be a deficit. There must be evidence that there's problem with the social skills. There's problem with communication. Communication would mean that there could be delayed speech, there could be loss of speech, or just challenges with communicating, processing what is being said, and bringing out, processing what they're saying. So they will struggle with non-literal things like figurative language, instructions that are complicated sometimes because of the challenges with communication. And like I said, stereotypic and repetitive behaviors. So I'm going to get into, so since we're unmasking autism, let's talk about the possible myth. Before I go on, I want you to type for me in the chat room. Possible myths. I mean, I know that not everybody here is hearing about autism for the first time. So I'm not going to even ask you for myths. So it's possible that you won't type myths if that's what. Just anything that you have heard about autism, particularly recently. Anything somebody has said about autism. Someone is telling you about autism. What did they say? Put it in the chat room. I have limited time, so I'm hoping that you will start typing ASAP. So I want you to tell me what. Sorry, 1 second, please. All right, I've seen one chat is in. Autism is beautiful. Okay. Autism is a different kind of ability. Yes, I've heard that before. I'm waiting for more, please. My time is limited. I'm waiting for more. I'm seeing justice too. I hope it's not my network that is limiting me from seeing it. I was really, really looking forward to hearing what you had said. And I'm not even saying you should just write myths, just anything I've heard about autism in recent times, you know. So this is Africa. I believe that most participants are joining from Africa, right? So in 2012, I can't remember. So yes, many years ago, because that's over 10 years, definitely. I was I was working in center owned by a school. Yeah, an autism center owned by a school at this point. And then one teacher, so I followed my boss to the main school and she was introducing everybody. I was like, oh, this is the head of school of the center, this is the head of the center, this is the head of the center. And so when lady came in, I was like, auntie, you're so beautiful, eh? So he said autism is having the ability to see the beauty that others don't see. That's beautiful. So he said, auntie, you're so beautiful. Let me, how are you now doing this work? Okay? You know that these children, that the spiritual something. And before you know, you want to know that the people that are doing them now come and do, that kind of thing. And I'm like, no, these children have angels. Their angels are going to work for me, you know. Because sometimes that's the myth that we have. Our first call when we see disabilities or anything that is different is that we think it's a spiritual problem. So the first myth I'm going to mention here, being a Nigerian, being an African, is that autism is a spiritual problem. Autism is okay. All right, thank you. All right, somebody was trying to turn on the whiteboard. So autism. Somebody say, you're not praying well. That's why you have a child with autism. That's why your child is not fine. Autism is not a spiritual problem. It's a neurodevelopmental disorder. It's medical. It can be tested. It can be, there's treatment somewhat, but the point is not as a result of a curse. It is not because the parents committed any sin. It is just what it is. One of my favorite scriptures, I must say, I'm a Christian, and one scripture that I really have come to love, I started to interact with families with, children with special needs, or just interact with people generally along this space, is that in the Bible, there's a story of a couple, Zechariah and Elizabeth, who did not have a child. The Bible says that they were already very old and they didn't have a child. And Jesus said, and this Bible actually said that they were righteous, and they didn't have a child. It didn't say, but and they didn't have a child. They were righteous. It's not a result of their sin. That life was not going the way they wanted. It is not a result of their sin. It's not because God did not love them. It's not because they were not living according to God's will for their lives. No, it just happened that they did not have children. It's the same way. Some people have children with autism, not because of what they have done, but because autism exists and anybody can have anything. Another myth I've heard that, I mean, almost anybody would have heard, is that the child is spoiled. Is it that bad? It's not that thing. It's just spoiled, Jerry. Beat him very well. I'm not beating him. If you beat her, all this nonsense will stop. You know, somebody saw me and said, I mean, people are always saying stuff like, the reason autism in the people are not talking about autism is in the West or something like that. Here, children will be forced to talk, or children with autism will be forced to talk in Nigeria because here, because we are not isolated, something like that. And I'm like, there are quite a number of autistic children that are not speaking in Nigeria. However, I cannot debunk the fact that yes, we might get a lot of results here. I don't know how it is in other countries, I mean, in Ghana and other places, but here right now, we have an influx of families who have children who live in the West, who are coming back to Nigeria for therapy because we are seeing the results that we achieve, right? But the point is, it is not a function. I say, in Nigeria, for me, his parents would have forced him to talk. The truth is, there are people who live in Nigeria who are autistic, who are not speaking. This one is very common. In fact, this one, it makes me laugh, and I'll tell you why. They say that a rich man problem. Have you heard that before? Now, rich man problem. Now, only rich people. Or now, white man wahala. How did autism come? It's white man wahala. Why are we talking about autism in Nigeria? White man issues. All these rich people. You know, it's rich people that have it too. People will meet me and say, hey, you work with children with autism. Wow, you must have a lot of money. I'm like, why should I have a lot of money? Don't be rich man problem. Okay, and they go pay you well. I'm like, I wish it was rich man's problem, right? But it is not rich man's problem. There are many families who have autistic children who, not just that they are poor or middle class, there are those that even live in rural environments. If it was rich man problem, should we have autism in villages? No, now. Should we have autism in middle income families or in low income families? It was actually a rich man problem. The only difference between maybe a rich man and the low income person is that rich man can find help more easily, can pay for the help more than the low income family. I mean, I've seen families who just, I'm always part of outreaches towards indigent families where people come to ask questions, and many of them cannot afford therapy. You know, some of them put their training just in a school so that they can go and work while the child is just in that school, just like that, because they can't afford anything different, right? But it is not a rich man problem. So that's one myth that we definitely, I mean, those are the funny ones, but there are others. The other myth. One myth is that only boys are autistic. It is true that you would find more boys. I run a business and we work with autistic individuals, and we have more. We have, interestingly, our ratio even beats the world standard of ratio in terms of percentage of autistic boys to autistic girls that we should be working with, or that we should. Way back they say it's 4-1 or 4 boys to 1 girl. But now they will say otherwise. That the truth is, it's really not 4 boys to 1 girl. There are almost as many girls as boys who are on the autism spectrum. The only thing is what I have not said before. that autism is a spectrum. Number one, it will look different in different people. Secondly, it is reported that girls are able to mask it more than boys. But whether it is masked autism or is not masked, autism is not a boy problem. There are many girls who are autistic, young girls, teenage girls, adult ladies who are on the autism spectrum. Autism is a spectrum, it will range from mild to severe. For some people, so there are three levels of severity, and in terms of diagnosis, there's a level 1, level 2, and level 3. Level 1 being the most independent type. So the person is independent even despite having autism. And of course, level 2, then level 3 will require the most support, right? So it will look different in different people, but it is not a boy problem. This one is interesting. Schools, people will say, oh, and this is another reason families or when parents get the autism diagnosis, it can break their heart because it is, some people say that autistic people cannot learn. Some people say, oh, all autistic children have intellectual disability. So they confuse ID with autism. Or you hear them actually saying, oh, this autistic, he can't learn, he's not talking now. He's not learning anything. That is not true. Autism does not equate to intellectual disability. There are many autistic people in the world who are thriving. Those who are speaking and not speaking. Many years ago, I worked with a child who was non-speaking and probably still non-speaking now. I worked with her when she was in preschool, right? And what I think back to that time, I mean, particularly this was about 10 years ago, to be honest. I think back to that time and I'm like, wow, I'm able to encourage teachers and other professionals that there's so much that our children can learn, and there's that different ways we can assess learning to know whether these people are learning or not. This girl, we would do she was not talking, she could not talk, she was non-speaking completely. But guess what? When we would do fractions in our class, tell her to identify the half, she would identify half. Identify quarter, she would identify quarter. I remember when we were doing addition of numbers, she will count the object and pick the correct answer and say, okay, this is the answer. I saw that 10 years ago, but guess what? I witnessed that again recently. I went for supervision with one of our client sites, and at one of our client sites, and during this session, there's a part because we work in schools, so the lady got to a point where they were doing academic work and they were doing addition, and I literally saw the child, saw the question, picked the numbers that they were manipulating, picked let's say 2 plus 5, picked 2, picked plus, picked 5, arranged it, put it equal to, picked the sticks and counted himself and picked the correct answer and put it. Because at this point, he couldn't write yet. Now he's writing, but this was it February or March? I think it was March. But this week he's writing. Guess what? That's interesting, yeah. And he couldn't write, and he picked the answer so that the scribe could write it for him. Is that not amazing? So if he was intellectual disability, would he have been able to do that? No, he wouldn't have been able to do that. And or can we say he cannot learn? He's not even talking yet. How much more the many children that we get to work with, that have experience, who can speak, who can show their skills in different ways. So autism is not a disability, they can learn. Autism, even the person that has a disability can learn. They might just learn differently, right? The next one is very interesting. They say autistic people are geniuses. Has anybody ever heard that before? If I got $1, I'm telling you literally, I don't want naira. If I got $1 for every time I have heard this or something close to this, by now I'd be a millionaire. I'm telling you, I will be a millionaire in dollars. Has anybody ever heard this before, that autistic people are geniuses? Or someone wrote here, people on autistic are poor, but else. I'm waiting to see. Okay, if you cannot type yes or no, you could do a thumbs up. Let me check. You could do a thumbs up if you agree with me that you have heard it before, because it's not possible that you have not heard it before. the autistic people are geniuses. And let me tell you the truth. Me, I would have said so too, because the very first time I heard the word autism, I was much younger, I was a teenager. I watched a movie about one guy called Tony DeBlois. True story. Tony DeBlois is a savant, autistic, blind person. Yeah. And he could play. Savant means that they are gifted, right? He could play music, any music he heard, like he could play, and he plays around the world. So I asked him to do the live because he came to Nigeria in 20. He had come many times, but I feel I witnessed him live in 2010 playing the what's that thing, the piano. Let me tell you the truth, it's a myth. I can see people are so excited in the chat. They're like, yes, I've heard that before. It's so true. It's so true. It is a myth. They are not. They might not have. They don't always have superpowers. They may or may not be geniuses. Of course, an autistic person is an individual, so they can be a genius. That's what they like. Just like an autistic person can have intellectual disability, but that doesn't mean that everybody has it or everybody is a genius. So they might have interest, might have specific interest, they might be exceptionally gifted in certain things, but it doesn't mean, but not all of them are. Not all of them are. And that's the reality. Why is it important that we know this? Number one, it helps us to teach them the skills that they require to survive. It helps them to learn to thrive. You know, one of the things when I was preparing for this was that came to my mind that what's the benefit of learning this is that when we break myths, when we understand autism, we can support every child to thrive. So I see somebody writing, they are geniuses and they are very smart. Well, if all of us, I mean, have you ever seen a toddler trying to get away with something? I mean, trying to sneak, and they're smart now. They're doing something wrong. They looked at you. Yesterday, on Saturday, interestingly, I was at an outreach, just like I said, I volunteer at outreaches where we interact with, we kind of serve families who cannot afford the service. And there was a girl that we brought, and she wanted to sneak away. And I just saw that she was looking at her dad and was sneaking away. I was like, hey. And she saw me, then her father looked up to turn. And I was just like, she's so smart, she's so smart. Yes, she's so smart. I'm not saying that they're not smart. But the point is, if we assume that they are geniuses, if we say that they are all geniuses, the honest truth is that there are people who will slip through the rocks. Those who need the services that we will not give them the adequate service, the skills that they need to learn to thrive, right? We might not teach it to them because we are limited in our own understanding of education. Not all autistic people are geniuses. Yes, they are smart. Yes, they are wise. Yes, they know more than we know that they know. Yeah, or they know more than we think that they know. But the truth is, not all of them are geniuses. I hope that's clear. If you don't agree with me, well, the good thing is that in Lagos State, you cannot come and beat me in my house. Is that okay? So, another thing is that, another myth, this one is so popular, is that the child will outgrow it. They'll say it's a childhood disorder. It is not, autism is a lifelong disorder. It's not a childhood disorder. It starts at childhood. So between 18 months and 3 years old, more often than not, is when the symptoms are more obvious. It's not like the symptoms are not obvious earlier on, but the truth is by that 18 or 3 years is like, something is up. And really, the symptoms must show before 3 years old. So if there's going to be loss of speech should have occurred before age 3. If there's going to be isolation, let's say before the child was not still seen isolated at the beginning of life, but at some point, just realize that everybody else is in parlor. John is in the room. What's the matter? That isolation really has to occur at start before age 3, right? So it starts at childhood, but it's lifelong. But the question is, are they going to always? So yes, because autism impacts their development, it impacts how they learn, it impacts how they develop, how they build skills. So are they I think we struggle through life just because there's autism. No, that's why there's therapy. We need to remember that there's therapy to help them out there. And as family members, yes, we need to actively teach skills, actively teach them to imitate, actively teach them to pay attention and engage with us, and of course, talk to them. Get them to talk back to you. Build the skills that they require to thrive. As they're approaching puberty, we're teaching them about themselves, about their bodies, about how they're growing, helping them understand who they are, and of course, helping them to understand skills that they require to thrive, even as adolescents. It's good to teach them, we're teaching them academics and all these things, so that yes, they can be independent and they can thrive. However, autism is lifelong. As they grow older, they begin to discover their differences, they begin to learn coping mechanisms. That's why there's the term masking. They start to mask and say, okay, this is how everybody else is doing. Can I do like that? But we have put them to imitate. They've learned to imitate others. So they're like, oh, this is how everybody else is on the straight line. Let me join the straight line. Everybody else is paying with 20 naira or 2,000 naira. Okay, I'm going to go there and pay with 2,000 naira. Everybody else is sitting in this particular way. I'm going to do that as well. As they grow older, they begin to notice how people around them are doing, and they try to fit into that mold. But it doesn't mean that autism has stopped existing. They do not outgrow it. And guess what? Autistic children don't learn to speak just because they are getting older. They don't learn to do things right just because they're getting older. Certain things will come because they're getting older. I will be lying if I say otherwise. But most skills have to be taught, whether they are getting older or not. So you're going to teach them to communicate. Because if not, they might not do it if you do not, even though they are getting older, right? The child is struggling with regulating emotions. And like, don't worry, it's going to get older. No, we're going to teach him how to process his emotions, how to talk about how he feels, how to understand and be self-aware of himself, because he most likely will not just outgrow it. Okay, let me run. So they don't outgrow it. It's not a childhood disorder, it's lifelong. This one is quite interesting. People assume, or there's a myth that autistic people do not want to make friends. Oh, he's such a loner. He doesn't want to make friends. I worked in a school, there was this boy with autism who would always sit in a corner during lunchtime. Always. Never anywhere else. That corner was like was like saying, back off, don't come near me. And if you came talk to him, like, why are you here? This is my own space. But the truth is, so it's easy to look at that kind of child and say, oh, he doesn't want to make friends. No, he wants to make friends. He might struggle with how to make friends. He might not know how to make friends, or he might not, because he might not know how to go and ask for friendship, but he wants to make friends. And this I have seen constantly in my practice. So I don't know if you would mention what they read. So I've worked in this field for over 15 years. This year would make it 17 years that I have worked in this space, yeah? And I have seen constantly that and I've worked in mainstream classrooms since 2015. So this February made it 11 years, I started to work in mainstream classrooms. And I've seen that when we help children to first learn to respond to others initiating play, and then we teach them to initiate play, it's amazing how they start to make friends. Even for those who have limited communication, they find their way around it. They do tag, they run, they come back. That shows, and before, at the beginning, it looks like somebody comes to say hello to them and they're like, don't talk to me. But the truth is, they really they crave companionship. Why? Because man is a social being. Man is formed. Part of our formation as human beings is that connection. And guess what? Autistic people also want it. However, just like an introvert, sometimes they also want their alone time. They want attention. They want to unwind. They need to, calm themselves away from everybody else. So they want to make friends, but they may struggle with how to make friends. There's this assumption that they don't want to communicate. Like, I don't want to talk. Well, that guy is not talking. He wants to talk. He just does not have the words to say. And so it requires that we teach them what to say. We teach them words. We guide them. We help them learn to communicate. But not just that. We also provide them with tools to communicate. What do I mean with tools? There's constant argument to say, oh, if you let that child use another form of communication, they will never talk. That is not true. Giving children an alternative form of communication will at least, first of all, give them the tool to communicate, and we can leverage on that to build speaking skills or speech skills. I hope that is clear. And so what are different forms of alternative communication? We call them alternative and augmentative communication. And what are they? We have pictures, we have sign language, we have devices. In Africa, it's more common to find people use pictures and sign language because sign language is low technology. Pictures are low technology, so devices will require. But now with smartphones, some people have text on their phones that help the child to communicate. But the point is providing an alternative form of communication. So many years ago, there was a boy I worked with, and in the center, I also about the center experience. And he used to be the word is violent, right? He would come and literally attack me. And we didn't know why, but by observing the behavior and paying attention to what they call the antecedent, the behavior, and the consequence, which is what happens before the behavior, the specific behavior, which meant that he was attacking me, I'm squeezing my neck, and what happens after, which is the consequence. We realized that every time he attacked me, he was trying to access the kitchen because antecedent is just that Mr. Lola enters the room, then he attacks Mr. Lola. Then everybody comes to save Mr. Lola, and he literally stands up from attacking me and runs straight into the kitchen to get something to eat. So, of course, he didn't have the words to tell us he was hungry. So what did we do? We would ask him to sign and say, and do like this. And while we were saying, eat, I want to eat. And then he started signing. Then he started saying, I will eat. Then he started to actually say, I want to eat. I'm telling you, the sentence expanded to him being very, very specific to say, I want to eat rice. I want to eat eba. I remember eba vividly because I'm like, you are even so specific on the kind of meals you want. I want to eat beans. And that behavior was obliterated completely. He never attacked me again. Once he could sign eat, and they were able to expand the language to actually say, I want to eat, and all of that. I hope that helps you understand the benefit of giving tools or exploring alternative form of communication with individuals with autism. Of course, in this context, I'm thinking children, but the honest truth is, no matter the age, it is never too late to start and say, you know what, I want to help you. First of all, have something to use to tell me what you want. I want you to have a way to tell me how you're feeling. Do you understand? And that same boy, I remember that when we wanted to teach him to say, I'm tired, he just said, put your head on the table. Once you put your head on the table, child will say, oh, are you tired? Tired? All right, stand up. Let's go get a blanket for you. Go to sensory room. You attend to him there, and then you come back and was fit to work again. Of course. So it's just so they want to communicate, but communication is just a bit more difficult. All right, this is the point I need to run. And I want to talk about many things that they want you to know. So I'm saying this, I'm going to say a lot of things in first person, but the honest truth is I'm definitely not the person speaking, but I'm speaking on behalf of the children that I work with. I've worked with children for so many years, so I thought that quite a number of them are now adults. So I think I can now speak for children and adults who are on the autism spectrum. So the first thing you must know is that behavior is communication. Whatever behavior we are seeing, particularly challenging behaviors, the person is trying to say something. So the child is throwing a tantrum. They are saying something with a tantrum. They are not just being naughty. Yeah? Autism does not mean that the person is naughty. So, but the question is, how do we know what they're communicating? And that was just the story I just finished telling you. By paying attention to what happens before the behavior and after the behavior. Of course, you might need professional help to be able to do this effectively. But I'm going to talk about professional help at the end of my presentation. Can you give me, let me see if I can run through this in the next 5 minutes, right? So that we have enough time in case people have any questions for me. So behavior is communication. Something else. So I might communicate differently. So they want you to know that I might communicate differently, but I want to be heard. I want to be heard. Oh, I might not be able to say that I want to eat, but I want you to hear me when I say I want to eat, in whatever way I say it. And so by hearing them when they say it in a different way will help them help us teach them appropriately. Imagine with that boy I talked about, by paying attention to what was happening, we were able to teach him to actually request for food in an appropriate way. Imagine if we all just attacked him and beat him, beat him. Stop doing that. The boy will starve, right? But he was able to learn to ask for food because we paid attention. We knew that this behavior, he was communicating something. He wanted to be heard. This is also important. I might process sensory information differently. It might be too much for me. It might be too little for me. When it is too much, I am hypersensitive. When it is too little, I am hypersensitive. What this means is that we all know about the 5 senses, but we actually have about 7 of them. So what comes in through auditory sounds, auditory, visual, through our smell, taste, touch, all of this information, it can be too much. So some of them will react to clothes, to certain fabric because it's uncomfortable. It might react to texture of food. So you find them wanting to eat only maybe crunchy things or only soft things because the other type texture is very uncomfortable, right? And it's by paying attention, usually that the people that actually do a test to know which one is. And I'll talk about them within these 5 minutes. So, and you find them, so I talk about covering of ears. Sometimes what is coming through the ears can be too much. And for some, it is too little. Some, the touch is not enough. So they even need extra touch. So you find them coming to put their body on you because they're seeking sensation. And then some are even making the sound because they are looking for the sound themselves, right? So you find them like this, you might overreact to light or too many colors, bright colors. The truth is, how they process information is different. One symptom of autism is sensory processing disorder, and it usually is evident in the behaviors that we see. Guess what? Something else they want you to know is that I can have autism and another condition. It is called comorbidity. So somebody can have autism and ADHD. ADHD is attention deficit hyperactivity disorder. So yes, autism can come alongside ADHD, while ADHD can stay on its own and autism can stay on its own as well. Some people have autism and Down syndrome. Some have autism and cerebral palsy. Some have autism and they are blind. Some have autism and they are hearing impaired, they are deaf. Some have autism and they have high blood pressure. Some have autism and diabetes. It's called comorbidities. Comorbidities. Many people with autism will suffer from things like anxiety, seizures, epilepsy sort of seizures, depression, and all of these things. It's important to know this so that when it's time to treat anything, we know that, okay, while we're working with autism, we are also treating the comorbid situation. Oh, something they want you to know is that they have strength. You know, everybody has writing in the chat about how they are geniuses. Yes, you are right somehow. They have strengths. They are not a box of weaknesses. They are it's like a cocktail. And usually we need to pay attention to find the strengths. So some will pay attention to details. Just last week, a friend was telling me they do this project where they get people with disabilities into the workplace. And last year or a couple of years back, they helped a bank to employ autistic individuals into their IT space. And when we were reviewing a year later, it was a contract, it was going to be a 1-year contract. They actually renewed that contract because they were very impressed with how detailed these individuals were. Some of them are great artists, some of them are great musicians, some of them can dance, some of them are exceptionally brilliant, to be honest, like we said, geniuses. Some years back, I worked with one boy who was a spelling bee champion. Every April, I'm always at an exhibition of autistic of art by autistic people, children, particularly children and adolescents. In April this year, April 2nd, I was at an event where a boy in Nigeria, you can always check, his name is Kanye Chukwu Tago Keke or something like that, and he had ridden his a bike alongside other cyclists for 100 miles. He through different states in Nigeria. 16-year-old boy, 16 years old. I'm telling you, you know, he's a fantastic artist. He does exhibitions around the world, So they have strength. Some of them are just so. I worked with one child minute that was so good with reading. Oh my God, very precise, very precise. Some are able to, recreate experiences. So we cannot focus only on their weaknesses. Also, they want you to know that what they don't want sympathy, they need empathy. Put yourself in their shoes, don't pity them. And that's how we can empower them. That's how we can empower them, right? So quickly, in 1 minute, I'm going to quickly run through that they are different. So in getting help, one thing you should know is that autism, there is help. When a parent first gets a diagnosis or when they start seeing their child lose skills or not develop skills at the right time, it can look worrisome. It can be quite, I'm looking for a word that is positive sort of to describe it, but it can affect them in some ways. But one thing a parent must know is that there is help. And among the different helps that you can explore, one is support system. Identify your support system and probably even finding support system, maybe support group of people who are in your, who kind of like help you through your journey. But another set of people to be looking for oftentimes are therapists, people who are professionals who work with individuals with autism. Now, what's interesting is that these professionals, while they might work with autism, this treatment or these therapies were not designed only for autism. So it means that you must be specific about what service you're looking for. So the first one I want to mention is behavior therapists. So across Africa now, you can always definitely find behavior therapists, at least in the big cities. So more often than not, this practice applied behavior analysis. They are usually ABA professionals, and they use evidence-based strategies to increase positive behaviors, improve communication skills, enhance social skills, build cognitive skills while reducing challenging behaviors. I'm going to take that again. So these behavior therapists, they use evidence-based strategies to increase positive behaviors, improve communication skills, enhance social skills, build cognitive skills while reducing challenging behaviors. Next is the occupational therapist. Now, there are different kinds of therapists that work with autistic people, but I'm mentioning the key ones. Occupational therapists also use evidence-based strategies and structured approach to teach activities for daily living, thereby enhancing independence. So I said earlier that, okay, now, so they will pay a lot more attention to basic life skills that will help this individual to become independent. They also support sensory needs. So I said there are people that check is this person hypersensitive or hyposensitive. They do the testing and they support sensory needs. They improve motor skills. They improve social and communication skills as well. The next one I'm going to mention, I'm mentioning the third on purpose because they're the first that parents always ask for, are the speech therapists, speech and language therapists, or pathologists. They also use evidence-based strategies, and they teach and enhance verbal and non-verbal communication. They support understanding and expression of language. They support understanding language. Guess what? We also behavior therapists also do that, but they do that in their work as speech and language therapists. They address communication disorders, including speech and language disorder. So when it comes to articulation, fluency, there's an impediment limiting, even chewing. Can you imagine they work on chewing? They work on things like that. So fluency, voice disorders, they will look at that. They look at how language develops, following grammar rules and all. And they also teach alternative forms of communication, like I mentioned before. Of course, there are other kind of therapists that exist, like there are music therapists, play therapists, educational therapists, but the three main ones are the ones I have talked about. And finally, I would say that autism, like I said before, autism does not mean that the child cannot learn. Many autistic individuals are thriving in mainstream classrooms. But guess what? For them to thrive in that classroom, there must be adequate support, and we must identify what kind of support it is. We must find a way to assess the learning, both formative assessment and summative assessment. Assessment that is ongoing, of course, the final assessment. So it's important that we know that. I mean, I work with children in the school system, and I'm seeing many of them who even do better than their peers. So autism is not a death sentence. One thing we want you to know is that autism is not a death sentence. It's not the end of the world. It is not final vibe. No, it is just a detour. It's just an extra. It's a different way of seeing things. It's a different way of the brain works differently, and that's why it's called neurodiversity. The brain works differently, but with the right support, with love, with the right support, because not pampering support, but support that is adequate, these people can live fulfilling and independent lives. Thank you very much. I dropped that in. I hope I'm still online. Oh, someone asked that what's the first therapist I mentioned? Behavior therapist, and this is usually applied behavior analysis. It's usually the technique that is used, but there's what we call teach as well. That's in South Africa, that's quite common, but in other parts of Africa, I think ABA is more common than teach.
All right.
I hope that answers your question.
Thank you very much, Madam George Adelola. Yes, I got it right.
You actually, I mean, it's amazing how you're able to call my name and you could not call Awolowo. Awolowo University. I can say Adelola. That's amazing. Well done.
Thank you very much, man. Thank you very much. All right, so at this point, if you have any question for Madam Adelola, you can raise your hand. If you want to go verbal, you can raise your hand. If you want to also put it in the chat box, you can just put it there, and then it will be read. We have just 10 minutes of questions and answers, and then we wrap up. All right, we didn't start early, but 10 minutes of question and answers will do. So if you have any question, you can just raise your hand. I'm going to mute you. Then you can ask your question, or you can put your question in the chat room, and I'll be glad to read it out for Madam to answer you correctly. And thank you very much, Mom, for such an insightful message on autism. In fact, there are some people, I believe, who are now hearing the word autism for the first time, and there are also some people, yes, exactly, that we collected, the data we collected, there are some who are now hearing it for the first time. And so I like the fact that Madam Adelola was able to bring it down to a level and made us to understand the facets of autism spectrum disorder. Thank you very much, Ma. Are there any questions you want our facilitator and keynote speaker to address? Are there any questions? You can put up your hand if you have any question, or you can just drop them in the chat room, and I'm going to read that out for yeah, so if you want to talk, yeah. So I'm saying that if you want to talk, there's someone says we can unmute. Yeah. I'm saying if you want to talk, just raise your hand, okay, just so we can have an orderly presentation questions. All right. So just raise your hand using the icon, and I'm going to unmute you so you can ask your question, suggestion, recommendation, where you need clarification. and Madam
All
Adelola.
right, so some questions are coming.
Right,
So
fantastic. You can take them.
So first of all, let me answer. Someone said, how do we differentiate between autism and cerebral palsy? First of all, cerebral palsy is quite visible. So autism is really referred to as an invisible disorder because disability, because it doesn't show literally on the face, like maybe Down syndrome, that if you see the child, you can tell that something is different. Or a blind person, that more often than not you can see that something is different, right? But cerebral palsy affects the limbs and the muscles, the part of the brain that controls movement is affected with cerebral palsy. So the symptoms are different. So delay is also existing, but there's delay in motor development, including sitting down, neck control. Autism, there is no problem with neck control, with sitting down. Naturally, like autism can be a comorbid situation, but autism itself will not cause delay in motor development or in gross motor development. Then, so if an autistic child does something, sometimes say they know what they did. I want to ask if it's true. Many times they are conscious of what they are doing. Many times, but there are some things they cannot control. So, for example, when there's a meltdown, which is usually as a result of being overwhelmed, they don't know what to. I mean, at that point, they're not controlling that behavior. Is their body or their body's responding to the sensory overload? However, some children, this is interesting. So why do we even look at what they call this ABC that we talked about, the antecedent, behavior, and consequence thing? Why? Because we want to check the function of the behavior. And there are four basic functions of behavior. Number one is attention. Number two is avoidance or escape. Number three is access. Actually, number one is only access to tangible. Let me rearrange. Access to tangible, attention seeking, avoidance or escape, and the third thing is what they call automatic reinforcement, which is, we also call it sensory behavior. So I like it. I am doing it because I like it, or it relaxes me, or it helps me to cope. So attention, I want your attention, and so I behave in this particular way. So true, a child might notice that every time they cry, mommy pays attention to them, so they will keep crying. So they are aware of what they are doing. The child notices that if I say I want biscuit and nobody answers me, but I throw myself on the floor, oh, I will get the biscuit. That's access to tangible, right? And so yes, they are aware, but then not every behavior is as a result of them being aware and doing it on purpose. But most of the time, yes, they know what they're doing. Like I talked about the child who was looking at her dad and trying to run away. She knew she was going to get in trouble if she was caught, right? So malautism and autism is the same thing. Autism is a spectrum. It will range from mild all the way to severe. So the impact of autism on different individuals will be different. For some, they are quite independent. They're going to school. But for some, it can be very dependent on others for help over time, because the impact is more on them than it is on others. So how do you handle a child with autism in the classroom? Good question. I hope I have time to answer that, but I'm going to answer you because I work in classroom and I help teachers engage children with autism. And I've done that for 10, 11 years, and I really love doing it. So I want to answer your question very well. Let me say another one before I come to you. When an autistic child does, okay, no, that's, how do we convince those who think that therapy rather destroys them? I never heard that therapy destroys the child. Tell them that therapy is the treatment, and that it gives the child the opportunity to learn how to be independent. Therapy will help them learn to communicate. Therapy will help them learn life skills, how to be independent, help them to even learn how they learn. These children begin to appreciate, okay, this is how I learn. Someone said, how do we get a certified occupational therapist? I live in Nigeria, so usually in Nigeria, they are registered on a particular board called the Medical Rehab and Health something board. Let me quickly check that. I have that written here actually, but because I wasn't talking to only Nigerians, I didn't say it. So Medical Rehabilitation Therapist Board, MRTB or something like that. in Nigeria. So find out in your country where they are, what board they are registered on, and from there you can actually get. So I think, okay, so how do I, a facilitator, communicate to parents who do not agree that their ward is autistic and think that their child is being a child and being autistic? So let me say this, nobody else can tell. I mean, you don't have the right as a facilitator to diagnose a child with autism, to be honest. So, but you can actually be concerned that there's a reason for these behaviors that we see. There's a reason this child is different. And usually what you tell parents is that I am concerned about these things and we need to find the answers to it. And it is not really about comparing children. But let's say there's there's delay in this child development. This child language is not developing as it should. He's not sitting, for example, let's say he's hyperactive. Can we begin to ask questions? Can we speak to a doctor? That's actually the first direction to go. But let me tell you something that helped a situation many years ago. It was not autism, the child had learning disability. And for many sessions, the teachers had always told the parent that we are concerned about your child's learning. And every time the parents would say nothing is wrong with our child. So one time I was sitting in this meeting and the teacher was telling the parents, oh, your daughter, she's a born leader, she's this, she told the parent all the good sides. I mean, so many good sides of the child. And they're like, you are so right. In fact, she's the last born. But if you see her controlling her brothers like this, we know she was born to lead. Just said, however, I realized that she has been struggling in academics. This is how I've supported her. But I think that there is something, this is different from just having, not learning at the same pace with the peers. I want to understand it better. If you can understand it better, then I can know how to help her. So I want you to find out what is the possible cause that is making her learning delayed, slow. And the parent could not say anything because at this point, you cannot agree with the good and disagree with the bad, right? So that was it. And they actually went to find out, and they found out that their daughter she got a learning disability diagnosis. And I mean, the last time I saw her, 4 years later, she was doing so much better. Writing had improved, learning had improved. In fact, I always say that she was one child that COVID really helped. Many children with special needs struggled during COVID with online schooling. She really, really learned a lot more during online schooling because she had the help that was required. And she could only have gotten that help because her parents had come to agree that their daughter did need help, right? So, somebody said, Chawu is not talking. I will talk about learning. I'll talk to teachers now, how you can help children, how you can make your class inclusive, and how you can help children with autism to learn in your class. Someone says, which institution can you go and train to be able to handle this case? So first of all, in Nigeria, this is what I would say. Speech therapists, they usually go to university to study special education, then speech therapy and master's level. Occupational therapy, there's also occupational therapy, there's school for occupational therapy and the university. Behavioral therapy, on the other hand, applied behavior analysis, there are coursework providers registered on different boards. The common boards in Nigeria, and I don't know if there are other boards outside. I mean, these boards also exist in other African countries, but I don't know if you find them in the country you are in. So there's a QABA board, QABA board. You can check that out. I can look for coursework providers in Africa or in your own country. Then there's also the IBAO, International Behavior Analysis, something. So I'm trained my coursework provider is registered on the QABA board. So Qualified Autism Applied Behavior Analysis board, right? So yeah, those are the boards. In Nigeria as well, I don't know about other countries, There's another training called the Special Needs Therapist Training by an organization called Patrick Language Center. I like to talk about it because I know people that have done the training and they seem to be doing very well. So that's another option that exists here in Nigeria. Other ones I'm not aware of. So that's where you can get through. So let me go right into the teacher part. How do you help children with autism in your classroom? Now, understand that autism will present differently. So you have met one child with autism, you have only met one child. So that you work with one child in your class now who is autistic does not mean that you're going to replicate the same thing every time. But these are key things that can help you. Number one thing is to actually know the child. That child is a child. Autism is just an extra on the child. So you want to identify, know the child. How is this child learning? How is this child engaging? What are the subjects of interest? What does he like? What are his interests? Particularly when a child is speaking or child is not speaking does not even matter. I know that when a child talks, it really helps, right? For example, I always tell the story of one boy I worked with who liked dinosaurs. How would I have known he liked dinosaurs if not that he always talked about it, right? One of the children I work with right now actually loves cars. And if you want him to do anything, just say, do this and you get it to play with my car. And bam, he has done it. I know that because he can talk. But guess what? I don't lean on talking only. So if I present different toys, different activities, I'm looking at which one this child interacts with more than the others, or with the most. And that's how I determine what are his interests. What are the things that can work? But finally, so how do you help this child to thrive in your class? Number one, differentiate your learning. What identify what the child already knows in your class. What does this child know? As teachers, we move from known to unknown. We say, okay, we usually say the children already know to identify letter sounds. So they will now learn to blend the sounds, right? The children already know can count numbers. Now they are going to add numbers together. That's it. So where is this child now? Guess what? Even if in your class, the children are multiplying, and this child, all he can do is count numbers. So which means that the next step is addition of numbers. Do you know that you can still include that child in your class, in that lesson? Others are multiplying, but this child can do repeated addition because multiplication is the same thing as repeated addition. The only difference is that we have to cram this one, and this one we have to solve it ourselves. Does that help you a bit to see that you can engage any child? Now, does autism mean that the child will not learn at the same pace as their peers? That's not true. But in case this child, because of communication issues, is not learning at the same pace as their peers, you want to make sure that you still include them in your class. So pay attention to interest, include their interest in your teaching. Create to help make sure you identify where they are, and link it to what is being done in your class. Because if there's no engagement happening, inclusion is not happening. If that child is just sitting down there, then there's nothing like inclusion. So you must be including them. Thirdly, you also want to make sure that in your room, your classroom is inclusive. If is inclusive in such a way that everybody is respected. There's what we call body system in supporting people with special needs. Body system means I can pair this child who has special needs with another child who does not have special needs, and this one can help this one. These children can help this one. Those are ways. So this child struggles with sitting down. There are people that will say, okay, come and sit beside me and engage him so that he sits a little bit longer. And then we can increase how we sit a little by little. Other things to do is that you break things down. When you are teaching complex things, break it into small pieces and build from simple to complex. So we are teaching to write plenty sentences, do creative writing. But have we even formed sentences yet? Are we blending sounds yet? So make sure that you break it down. Identify the task. There's what we call task analysis. Take a task and analyze it and say, what are my children doing in this class when they are doing it? They are forming sentences. In that sentence, what should be there? Adjective, adverb, da. Okay, let me make sure at least this child you know what exactly is expected of you. I hope that helps. And of course, for some, give opportunities for movement. It really helps for many children with neurodivergent, giving opportunities for movement. Give them chores in class. Tell them, go and share the pencil, share the notebooks. Give them responsibilities. That also helps their social skills because then they're able to pay attention to their peers. Because I mean, if I have to go and talk to my peer, to my classmate to do something, guess what's going to happen? There's a high likelihood I will know their names, right? So it really, really builds their destiny. I must say, because there's so much to say. Okay, let me say visual. Provide visual this thing. Have pictures, use videos, use music. Let your lesson be multimodal. Try everything, try all learning styles, because that child will now find. And one of the beauties of inclusion is that it helps that no child is left behind. You are trying to help the autistic child, but guess who else is being helped in that class? The child who does not have autism is also being helped. So, and then finally, honestly, so I'll talk about visuals. Yes. Okay, yes, assessments. Engage. You must assess learning. You must be able to tell that assess. You can explore different forms of assessment. You can differentiate assessment. So there are 3 ways to differentiate: through your product, through instruction, what you are teaching, through the process, how you are teaching. As I said, it should be multimodal, and of course, through product, how you assess teaching. The children can show you different ways. The child cannot talk, they can touch, it can match. No child should be left alone in your class, left behind in your class. My name is Adelola George. You can find me online. And if you have more questions, feel free to find me on Instagram, Facebook. I'm not very active, but those 2 are definitely. Adelola Edema George is my name on social media. Adelola Edema George is my name on social media.
Thank you very much, Mom. Adelola George. Yes. And so thank you very much. I think our time is fast spent, and we'll have to wrap it up here. We want to say a big thank you to our facilitator, Madam Adelola George. As you rightfully said, you can find her on all social media handles. Yes, most importantly on LinkedIn, Instagram, and a bit of Facebook. Yeah.
No, funny enough, Facebook and Instagram more than LinkedIn. But I will check my messages on all platforms. I'm also on Twitter.
Right. Yeah. So do well to connect if you are a therapist, if you are a teacher, if you are an enthusiast, somebody who wants to know more of special education needs and how to take care of children. Please, Madam Adelola George is the right source for you. Do well to link her up on all social media handles, and she is so wonderful. I mean, she's open to everyone, and she's going to connect with you so you can have a wonderful session. On behalf of Hooper Foundation, we want to say thank you very much to Madam Adelola George for honoring our invitation to speak on this year's conference. And we want to say a big thank you going out there to all our participants for today. We want to say that God richly bless you, and see you same time tomorrow. Tomorrow we have a wonderful session that will be facilitated by Madam Lara Oshenuga. Yes, and she would be talking on what I wish I knew earlier. What I wish I knew earlier. Parents' Guide to Neurodivergent Journey. And so, see you all tomorrow. And it's bye-bye for now. Our time is fast spent. Bye.